and so on. So I just want to remind us, because as we work the next 2 days, I want to remind us of some of the aspects of intervention. There are the actors of intervention. Actors include multilateral organizations such as the UN, bilateral organizations such as national governments working with other governments. States and provinces do a lot on their own. Cities, huge city associations happening around the world with great power doing development. NGOs, of course, associations of NGOs, the growing power of NGOs, CBOs, community-based organizations, the private sector. Corporations rule the world. Have you read David Corton's book? Corporations rule. When corporations rule the world, it's happening. The corporations now rule the world, if you really look at the facts. So we got to work, we've got to keep changing the mindsets of the corporate sector. Academia, the media, the power elites. Okay, then there are the issues of intervention. We know all these. HIV, AIDS, you can enter through there and touch the whole system. Governance, leadership, participation, human rights, electoral reform, judicial reform, e-governance, IT, decentralization, local governance, urban development, rural development, public administration, poverty, equity, gender, huge issue, women's empowerment, equity, crisis situations, working in conflict, dispute resolution, natural disasters. Ken Hamji has offered to share his methodology from Peru, on natural disaster mitigation and recovery and relief. Very fine work done in Peru on that. And he would like to share that through ICAI and others. The environment, global warming, energy, children, youth, food security, education, health, failed states. Whole states are failing now. The Somalias of this world, just states, stateless states, states without functional government. There's so much crisis. And then finally, what is the new development epistemology? Meaning, what is real? What can we know? How do we know that we know what we know? Is it only statistical? Some development theorists only look at statistics. But we know that it's also anecdotal. It's also the postmodern view it's based on what people feel, think, know. So you ask people. People participate in their own evaluation, their own measurement of change. And then the MDGs. I just want to touch on the MDGs, the Millennium Development Goals that the UN launched in 2000 with 189 nations signing off. 189 nations attended, and then 147 heads of state signed the UN Millennium Summit in September of 2000. That these are 8 goals, the first time in human history that we have measurable, time-bound targets of development for our species. It's incredible. Specific, concrete, time-bound, measurable goals for the human race. The first one, and these have 21 quantifiable targets with 60 indicators, and there are 8 of them. And by 2015, the targets are number 1. And I won't give, obviously, we can't get into all the targets and indicators, but the first goal is to eradicate extreme poverty and hunger around the globe by 2015. And extreme poverty is the World Bank's definition of $1 a month, $350 a year. Number 2, achieve universal primary education so that every child has some form of primary education. To promote gender equality and empower women, goal 3. Goal 4, to reduce child mortality. Children are still dying at birth and in the first year, the second year. It's scandalous. Goal 5, improve maternal health. Mothers are still dying by the droves in countries. Combat HIV/AIDS, as many of you are doing, malaria and other diseases. Goal 7, ensure environmental sustainability. Goal 8, develop a global partnership for development. So that the last goal undergirds all the other goals. You develop the partnership in order to do the other 7. So you have the global partnership that does that. And then there are other things, but I won't share that here. Then the levels of intervention. We used to work at the community level. That was kind of our preferred level. or the organizational level. But of course, those are only two of many levels. You can work at the individual level, see, such as the literacy program, or the family level, work with families. The community level, organizational level, institutional level, which is broader than organizations, like the whole judicial system, or the systems level, actually you could call that. The system, including many institutions, of which there are many organizations, the city level, the state level, provincial, national level, regional level, global level. This is just to remind us as we work the next forms of intervention. We can do projects to demonstrate change, programs to impact systems, policy change the institutional arrangements, the legal frameworks. We can advocate change at that level. We can work as administrators, managers, raising funds, PR, campaigns to raise awareness, create communities of practice, networks and interchange. Geography of intervention, of course. We can decide to focus on Africa. Some of the colleagues, when they wrote in on answering the 5 questions, said, ICA-USA, focus on Africa. You could decide that strategically. That could be a strategic priority, or not. It's a decision. Africa, Asia, Pacific, Latin America, Caribbean, Eastern Europe, the CIS, Arab states, Western Europe, North America. Cycles of intervention. The project cycle. We can decide to focus on the strategic situational analysis level, or the design of intervention through planning, or design of indicators to measure change, or funding and staffing, training, initiation of intervention, the management and implementation, which is the bulk, monitoring, evaluation and feedback, the feedback loop of that knowledge back into the system and to change policies. And then methods of intervention, top, social artistry, the integral approach, emotional intelligence, appreciative inquiry, whole system design, open space, and on ad infinitum.